Well, April is always an exciting month. It's spring. People are enjoying the weather. Easter is around the corner and it's family time. But there is one more thing. April is also Alcohol Awareness Month. And if you are struggling, we want you to know that there is help. I want you to meet Dr. Donnie Sansom. He is with Sierra Tucson and he's here to explain how they can help you. Good to see you. And I thank you for being here.
Good to see you. Thank you for having me.
So let's talk about this because, you know, right now top of mind and in the news a lot is the opioid crisis. And we're hearing that this is, you know, taking over, which it is very, very serious. However, you're here to remind us that alcohol awareness and alcoholism is much more serious.
Well, it is, if we look at the data. Of course, opioids need to be front and center. It's a public health crisis. However, alcohol still kills more Americans each year. So the most recent data on the opioid crisis is that it kills about 70,000 people in the year 2017. In the same year, alcohol killed 88,000 Americans, making it the third leading cause of preventable death in America.
Preventable is the key, and that is exactly why you're here. What are some of the reasons that you find, and I'm sure there's several of them, but some of the main reasons why people come to you because they've turned to alcohol?
Right, that's a great question. So it's a question a lot of people have when they come to us. We know there's a genetic component that's very strong. It represents probably about 50% of the reasons people have an issue with alcohol use disorder or alcoholism. The other 50% is spread out over a variety of things such as early use by adolescents, family social structure, your peer group deviancy, socioeconomic status, but also trauma, past life trauma like adverse childhood experiences we find play into this significantly.
Okay. Somebody decides that, you know, it's time. I need to make that phone call. How does Sierra Tucson treat this disease? And I'm going to call it a disease.
It is a disease. It is a disease. We have good data that's long-standing. We know it's a disease. So that's an important point. So I think of all the things we're going to say this morning, maybe the most important for individuals to realize that withdrawing from alcohol can be very dangerous, and for many people just shouldn't be taken lightly or done alone. It can be more dangerous than opioid withdrawal.
Really?
So yes, and so one of the first things that Sierra Tucson would do would be to bring a patient in and evaluate them and treat them in our medical detox unit where they can be evaluated, monitored, given medical assistance if need be. And then that patient would move into our residential treatment area. And that's where we really do the work. That's where we bring in holistic therapy, mind, body, and spirit, integrative therapy, experiential therapy. So we work with some of those trauma issues, the co-occurring disorders such as moods, such as chronic pain, maybe a secondary eating disorder. And we bring all of that to bear to look at what things are playing into the individual's disease of alcoholism.
You have a self-test that people can ask themselves to find out, you know what, maybe I have this disease. What is that self-test? Well,
there are lots available. One that we like is the CAGE test. So CAGE, C, have you ever tried to cut down on your drinking and found it difficult to do? The A is annoyed. Were you ever just annoyed that everybody's on me about my alcoholism? Is that something you're noticing? G, do you feel guilty, maybe, you know, subjectively, and it's going to have to be some self-honesty there. And then E is an eye-opener, so it's sort of the old hair of the dog. Do you find that you need to start the day with a drink? Do you find that you're very jittery until you get that first drink in early in the morning?
Yeah, and if you answer yes.
To 2 or more.
To 2 or more.
Correct. 2 or more of those, then you probably need to speak with your healthcare provider, or you can go to our website and we have people available on the phone that will talk to you and help you determine.
That's important to know. As a matter of fact, I'm going to give you that information right now. Dr. Sansom, thank you.
Thank you.
For being
I appreciate
here and helping to create or keep the awareness alive. It's a very important topic, and Sierra Tucson is there to help you. Here is where they're located, 39580 South Lago del Oro Parkway. That's in Tucson. And here's a phone number to call, as he mentioned, if you just need to talk to somebody, 800-624-9001, and learn more on the website, sierratucson.com.